Today I'd like to talk about the risks and complications and explain the procedure of facet debridement a little better. You've had some blocks, you may have had some RF treatment to your facet, painful facets, and got some temporary relief. The purpose of this procedure is to make the relief permanent. And I'm going to show you in a moment how this is done. But the idea is to actually laser or thermocoagulate the nerves that go to the facet joints so that it's no longer temporary relief of pain, but permanent relief of pain. The idea is this is a lumbar spine, and the facets are these little joints in the back here. They kind of connect the vertebrae. The vertebrae are separated on the front side by the discs, and on the back side they prevent rotation. You know, if you were to twist your spine like a golf, there's actually some blockage here stopping. So the facet joints are that. But also the other thing that happens with the facet joints is as the space here narrows, the little joints here can get off center. They can get pinching the tissues inside of them or stretching the capsule that covers them. So the operation is performed through a tube approximately this diameter. This is smaller than a dime. This is about a little over 14 millimeters. And it's actually through a incision less than an inch. It's actually placed down on top of the facet joint like this. And then with the TV camera and the suction and all being put down the tube, I can actually get to various places on the facet joint. And with that, I can actually get to the two places that are really important, and that is the top of the facet joint here and the bottom of the facet joint where the nerves enter. Also, a little capsule is taken, which also prevents the recurrence of the pain. So this is essentially what is done during the procedure. What can go wrong with this? Well, really not too much. It's just simply a laser debridement of the soft tissues. Infection, I guess, can occur. Incredibly rare. I've done thousands of these, and I don't really know that I've seen but maybe one infection or maybe two. Usually superficial where the stitches are. I've never seen a deep infection in this area. So very rare, but I guess it could happen. Anytime you make a skin incision, an infection can happen. It might stitch. You might have a little stitch reaction as well, and that's a possibility. Other than that, there's no real nerves to be injured here, other than the ones that you're trying to intentionally injure. You're not inside the spinal canal, so no risk or danger to the spinal cord or nerves. I guess it's not really a complication, but it's a possibility, and that is that the operation does not completely relieve your pain. And you go, well, geez, why would that be if we're cutting the nerves or lasering the nerves? Well, the fact is that other things can cause back pain as well. And as I said in the beginning of the tape, probably the major reason that the facets are getting painful is the discs have started to degenerate or collapse, which can also be a significant contributor to back pain. So you can get partial relief of the pain, but you may not, since we're not operating on the discs, that's a different kind of a problem. But I would say that would be the major reason that you would not get complete relief, and which is not a complication, it's a statistical. So this works about, depending on whether you do it in the lumbar, the thoracic, or the cervical. Depends on how much relief of pain. So probably about 65–68% of the time, I would expect at least 50% relief of the pain after 2 years. So that kind of concludes the discussion on facet debridement surgery. If you've got any other questions, please don't hesitate to ask me. This is a great time after seeing this video. Okay, great.